Hi everyone, this is Dr. Jawad from Total Health Wellness Center. What I want to talk about in this video with the thyroid series is the blood test and how what's important for me to test for my thyroid patients is a functional thyroid panel. Now, the average allopathic doctors only test for two indicators, two markers, which is TSH and T4. But you can see here, there's more markers that I want to test for, because the more answers I get, the better off I'm able to evaluate and help my patients into better health. So let's go over these markers. So first and foremost, you have your TSH. This is your thyroid-stimulating hormone. Now what this indicates, it's a brain hormone from the pituitary gland. So if your TSH is high, it indicates that you have a low-functioning thyroid. And if your TSH is low, it indicates you have a high-functioning thyroid. So the next marker is T4. Now this is the inactive thyroid hormone that's produced by the thyroid gland. Now T4 is converted to active T3 throughout the system. So what T4 does, this just measures the strength of the gland. So you can see these are two highlighted in blue because this is what your allopathic doctor is testing you for to indicate if you have a high functioning thyroid or a low functioning thyroid, so they are able to prescribe medication. But you can see there's a much bigger list. So next you got the free T4. The free T4, this is a biological activity of the gland in itself. So you can see this measures its function as a T4 just measures the strength. Next we got T3. T3 is your active thyroid hormone. Next we have free T3. Now this is much more important because this is the thyroid hormone. After it gets converted to T3, this is measured active at the receptor site. And this is 300% more biologically active than T4. Because remember, they all get converted in the liver, in the gut, and the target tissue. So this is the one that's very active, and this is important. Next is reverse T3. Now reverse T3, this is the percentage of hormone that the body cannot use in some way, shape, or form. And we won't get into that in this video. Next, we have T3 uptake. T3 uptake is how much of T3 is actually being utilized by the thyroid-binding globulins. Now, for example, females who are on oral contraceptives, birth control, what happens is that they have a decrease in T3 uptake. So they could be suffering from hypothyroid symptoms by using birth control. Or let's flip it over. With PCOS, what's going to happen, they're going to have an increase in T3 uptake, so they're going to actually have hyperthyroid symptoms due to the excessive amount of testosterone being produced by the ovaries. I'm sorry, due to the ovaries. Next you got TPO and TBG. TPO, this is your thyroid peroxidase. Now what thyroid peroxidase, it's an enzyme produced by a thyroid gland. And also you have TBG, this is your thyroid binding globulin. So these two tested, if they're elevated, they're good indicators of an autoimmunity. Now, 80% of hypothyroid patients that I've run into, the autoimmune disease they have is Hashimoto's. Now, Hashimoto's, it's an autoimmune disease. That means that your own immune system is attacking your thyroid gland. So you can see here, there's 8 indicators for a functional thyroid panel, because if you're experiencing eyebrows thinning, fatigue, weight gain, mood issues, hair loss. This is just five symptoms I just put together on top of my head. But if you're experiencing any of this and you're not getting the answers you're looking for, please give me a call, 630-653-2225, or visit my website at www.totalhealthdupage.com, or visit my YouTube page and give me a call for a free consultation. Thank you very much. Thanks for watching.